read through on stress and fertility. And this systematic review has been published in RBM Online in 2023, titled Characteristics, Prevalence and Sources of Stress in Individuals Who Discontinue Assisted Reproductive Technology. A very interesting subject which they have mentioned. And all of us are interested in increasing our successes by holding on to our clients. So, don't you think it's very important for us to recognize stress and approach stress proactively? And this is what I want to stress upon all of you, that approach the patient or the couple related stress proactively, inquire up to that, and let's know how this systematic review has evaluated stress. It says that dropout is a very important failure of ART treatments. What's the point in just trying a success rate of 40 or 30%, just one cycle, and you drop out completely? And that would be very sad. Wish that this couple would have done some more cycles. And pursuing several treatment cycles has a better pregnancy rate, and that's well known to us. So very few of us or very few patients approach IVF as multiple cycles. Loads of patients, couples, they take, let's take one chance of IVF, but we need to tell them taking multiple chances of IVF will be more beneficial than taking that one random chance. And stress is an important reason for fallout of ART treatments. So what could be the source of stress, or what are the stressors? It could be physical discomfort of taking so many injections, discomfort to going to some destination and taking injections, because in India not many people will take self-injections. Family demands, ever increasing family demands and pressures build on the couple very much. There is a fear of failing because no center is guaranteeing 100% success, but the cost of treatment is pretty high. So economic stress can also be there, and there is a time pressure. How much time couple can give for planning a pregnancy? They have other objectives in life of making a good livelihood, or making a home, or earning some more money, or going abroad, etc. So there is a time constraint as well, and all these are stress factors. All these stress factors act on the hypothalamo-pituitary-ovarian axis, also increase the cortisol and adrenaline, and that will have its somatic and the emotional effects. And it could be some lady having tachycardia persistently, she has cold extremities, and she gets vasovagal attacks very frequently at smaller procedures. There could be chronic stress, and this chronic stress can lead to an eating disorder, irritability. It could be tiredness, anxiety, even sexual discomfort and marital disharmony can be result of a chronic stress event. Firstly, when the couple is absolutely unaware about infertility, just knowing the diagnosis that they are infertile itself is an acute stress by itself. On top of that, inability to conceive due to repeated treatment failures causes more amount of stress, and that leads to a chronic stress phenomenon. And that chronic stress can lead to a catabolic damage, and now a somatic condition and organ damage will come in front of you. 30% of couples in this systematic review said that stress is one of the main reasons why they discontinued treatment. The reason of stress could be different. Advancing age and lower ovarian reserve plays high on not only the stress of the couple, but also on the stress of a doctor, because this is one combination is so dreadful and will require more cycles of IVF to go ahead. And uncertainties of increasing financial and physical demands, and those demands are not translating into an equal increase in the pregnancy rate. In a couple with a lady of 38 years or more, just increasing or using a better drug or giving a loads of pre-treatment, improving on the luteal support can increase the cost of by few thousand or half a lakh rupees. But will it increase or double the chance of pregnancy? That's a big question, isn't it? So I feel whenever a couple comes, it is our duty as fertility consultants to proactively ask them, please tell me what are your stressors, and discuss the stressors. Take their attention away from the stressors. Do a loads of positive counseling so that we can decrease their stressors, or not to hurry up to treatments, better to decrease the stress a bit and then put forward a step towards treatment. And that will be highly appreciated by couples. And if you can hold on most of your couples to do 2 cycles with you, obviously your take home baby rate will be